Have you ever stopped to think about the silent battles happening inside your body? Battles you might not even know are taking place? Today, we're tackling a big one. High blood pressure, also known as hypertension. It's often called the silent killer, and for good reason. The scary truth is that many people, we're talking about a third of the 50 million Americans who have it, don't even know they do. They feel perfectly fine. There are typically no symptoms. So, how can something with no warning signs be so dangerous? Well, unchecked high blood pressure is like a slow burn, quietly damaging your heart, your brain, your kidneys, and even your eyes. We're talking increased risk of heart disease, stroke, kidney failure, and vision problems. That's why it's so important to be informed and proactive. High blood pressure doesn't discriminate, but it is more common in certain groups. For example, it's more prevalent in black adults than white adults. It also becomes more common as we age. Interestingly, before age 55, men tend to have higher rates than women. But from 55 to 74, the rates are actually higher in women. But these stats are just numbers. High blood pressure can affect anyone. So, what is blood pressure anyway? Simply put, it's the force of your blood pushing against the walls of your arteries. It's determined by two key factors: how much blood your heart is pumping and the resistance to blood flow in your arteries. Think of it like this: the harder your heart pumps and the narrower your arteries, the higher your blood pressure will be. When you get your blood pressure checked, you'll see two numbers. Let's break them down. Systolic pressure, top number. This measures the pressure in your arteries when your heart beats and pumps blood out. Ideally, you want this number to be below 120. Diastolic pressure, bottom number. This measures the pressure in your arteries when your heart is resting between beats. You want this number to be below 80. So, a reading of 120/80 mmHg is considered optimal. And remember, your blood pressure naturally fluctuates throughout the day depending on your activity level. High blood pressure is defined as a systolic pressure of 140 millimeters of mercury or higher, or a diastolic pressure of 90 millimeters of mercury or higher. Now, the tricky part is why your blood pressure might reach these levels. In most cases, about 90%, doctors can't pinpoint a specific cause. This is called essential or primary hypertension. But sometimes, high blood pressure is a result of another condition, like kidney problems, adrenal gland issues, or even certain medications like oral contraceptives. This is called secondary hypertension. On the flip side, there's also low blood pressure or hypotension. While often less a concern, dangerously low blood pressure can be life-threatening. A key symptom to watch out for is dizziness or faintness when you stand up quickly. It can be caused by medications, pregnancy, or illness. Let's quickly review the blood pressure categories to give you a better idea of where you stand. Optimal, below 119/79. Normal, below 129/84. High normal, 130-139/85-89. Hypertension stage 1, 140-159/90-99. Hypertension stage 2, 160-179/100-109. Hypertensive crisis, 180+/110+. Seek immediate medical attention. The good news is that you can take control. The best strategy to lower your blood pressure usually starts with lifestyle changes. Diet. Focus on a nutritionally balanced diet with plenty of fruits, vegetables, and low-fat dairy. Salt restriction. Too much salt causes your body to retain fluids, raising blood pressure. Cut back on added salt and avoid salty processed foods. Weight reduction. Losing even a small amount of weight can make a big difference. Exercise. Regular aerobic exercise can lower blood pressure, even without weight loss. Stop smoking. Smoking damages blood vessels, making high blood pressure even more dangerous. Limit alcohol. Excessive alcohol consumption can raise blood pressure. If lifestyle changes aren't enough after 3 to 6 months, your doctor might prescribe medication. There are many different types of blood pressure medications, and the right one for you will depend on your age, race, other health conditions, and potential side effects. It may take some trial and error to find the best drug or combination of drugs. Important note, never start or stop taking any medication without talking to your doctor first. High blood pressure is a serious condition, but it's also manageable. The key is to be informed, proactive, and work closely with your doctor. So go get your blood pressure checked regularly. And if you have any concerns, talk to your doctor. Don't wait. Your health is worth it.